Yep. Knock, knock. Hi, I'm Lindsay. I'm going to be your nurse today.
Hi, Lindsay. I'm Heather.
How are you feeling today?
I'm okay. How are you?
I'm good. Are you having any pain today?
No.
Good. I'm going to do a full head to toe assessment on you, so first I'm going to check your vital signs.
Okay.
I don't have a blood pressure cuff, so we're going to pretend like one. And we're going to wrap it around. You can switch on next. Yes. And I would pump it up to about 150. Good, and it's 120/60. I'm going to check your pulse. Good, 64, and you're breathing 12 times a minute, and your rate is regular. I'm going to check your capillary refill in your fingers. Very good. Okay. Don't go ready, hold down. Okay. I'm going to check your skin. It's warm, it's dry. You got good skin turgor. Very good. I'm going to assess your head. Do you have any pain?
No.
Good. The head is normal, no bumps, no lesions. Good. I'm going to test your head strength. Okay, so I want you to push back. Good. And now push forward. Good. All right. And look at your ears. Any problems with your ears?
No.
Any hearing problems?
No.
Good. Any problems with your vision?
No.
Okay, go ahead and close your eyes. Good. Eyelids and eyelashes are normal. Eyebrows are also normal. Head is normally symmetrical. I want you to go ahead and smile for me. I want you to puff out your cheeks. Good. I'm testing your cranial nerves. Okay, so next what I'm going to do is I'm going to palpate your temporal artery. Good. And while I'm doing that, I'm also going to palpate your sinuses. Any pain there?
No.
Okay, I want you to open and close your jaw for me. Good. That's testing you for your TMJ, or lockjaw as it's better known. All right. So next thing we're going to check is your visual field, okay? So first what I'm going to do is I'm going to have you look at the pen light, and without moving your head, just follow it with your eyes. Good. Very good. All right. Now just look straight ahead. I'm just going to check the reaction of your eyes. Good. Oh, sorry. While I got this, I'm also going to check your ears. Very good. I'm going to check your nose. Any issues with your nose?
Nope.
Good. Let's open up your mouth. Checking out the oral mucosa. It is normal. Can you stick out your tongue for me? Lift your tongue up. Move it side to side. Very good. Okay. Next, I'm going to check your hearing. So what I want you to do is I want you to cover your right ear, and I'm going to whisper 2 words into your ear. Can you repeat them?
Button, nose.
Good. And I want to do the same thing on the other side.
Frosting, Zoe.
Good. Any issues with your hearing?
No.
Very good. Alright, so next I'm going to palpate your lymph nodes. Any difficulty swallowing?
No.
No? Okay, good. I'm going to check your thyroid. So I would like for you to take a sip of water. Looking for any bumps or swelling or noticeable goiters. All right. So what I also want to do is I want to check to make sure your trachea is midline. I'm going to check your carotid pulse. I'm also going to auscultate it. I'll use the bell of my stethoscope. Very good. All right. So now what I would like to assess is your shoulder strength. Can you lift your shoulders for me? Very good. Now I want you to turn your head to the right, turn your head to the left. Good. And now again. Good. Now what I would like for you to do is raise your arms up. Bring your arms down to your side. Give me circle motions. And then go the opposite direction, please. Any pain or difficulty when you do that?
Nope.
Very good. Alright, so what I'm going to have you do now is I'm going to have you sit on the other edge of the ottoman here.
With my back to you?
Yes, ma'am. Thank you so much.
You're welcome.
So I'm going to check the spine. Any pain?
Nope.
Spine is symmetrical, no lumps. Now I would like for you to say 99.
99.
Again.
99.
Again.
99.
Very good. While I have your back to me, I'm just going to give you a listen here.
Okay.
Very good. I'm going to have you turn back around to the other side. Just going to check the front, just make sure you don't have any crepitus, which is just air underneath your skin. Any tenderness?
No, ma'am.
Not at all. Good. Oh. Also listen to your breath sounds in the front. Any shortness of breath or difficulty breathing at all?
No.
Any cough with any kind of sputum production?
No.
Good. Alright, so next I'm going to listen to your heart. So what I'm going to do is I'm going to listen to all of your heart sounds, and then I'm going to listen to your apical pulse for 1 minute, okay?
Okay.
Excellent. Your pulse is regular. There's no heaves or thrills or palpitations in your chest.
Well, that's good.
Very good. Alright, so the next thing I'm going to ask for you to do is I'm going to have you go ahead and lay down on the couch for us. So the first thing I'm going to have you do is I'm going to have you turn your head to the right, and I'm checking for jugular vein distension, and now to the left. Perfect. Alright. Now I'm going to listen to your abdomen. First I'm going to inspect it. And I'm going to listen to your bowel sounds. Are you having regular bowel movements?
Yes, I am.
Now I'm going to lightly palpate your abdomen. Any pain?
No.
Okay, I'm going to go a little deeper. Any pain?
No.
Good. Now I'm going to check your liver and your spleen. Good. And now I'm just going to percuss, tympanic, even vowel sounds. So now I'm going to check your abdominal aorta, your renals. Just checking all of your pulses.
Okay.
Sorry, this is just your femoral. I know it's a little awkward.
It's okay.
Excellent. You just write down my findings. All right, perfect. I'm going to have you go on ahead and stand up or sit down here on the couch again. While I have you standing, how tall are you?
5'2".
Perfect. Go ahead and have a seat. And about how much do you weigh, Miss Heather?
136.
Beautiful. All right, so I'm just going to assess your skin. Your skin is intact. It's warm. Do you have any issues with your skin? Open lesions?
No, ma'am.
Perfect. Okay. Just going to check all of your pulses. I'm going to check your brachial. Good. Radials. Brachial and radial. I'm going to go behind your knee here. Perfect. And your ankle. And finally, your toes on this side. Perfect. While I'm down here, you don't mind that I take off your socks, do you?
No, not one bit.
Perfect. While I'm down here, I'm just going to take a look at your toes. Good. So they look good, good shape. Good capillary refill. Any pain with your feet?
No, ma'am.
Okay. What I want you to do is I want you to push down on my foot like you were driving a car. Perfect. Pull up on my feet. Good. And push down. And then pull up. The next thing I want you to do is I want you to take your heel here and I want you to slide it down the opposite shin for me. Good. And do it on this side. Perfect. Now I don't have a tendon checker, but we will use my stethoscope. We're just going to check for your deep tendon reflexes. Good. Perfect. Good. The knee one always gets you now. There's knee doesn't. But that's okay. All right, good. Now what I would like for you to do, I'd like you to do kind of swirlies with your ankles. Any pain or tenderness there at all?
No, not at all.
Good. I want you to go on ahead and stand up for me. I want you to raise your hands above your head. And can you just bend down and try to touch your toes? I know at our age sometimes it's a little difficult. Good. Spine is symmetrical. Any pain?
No.
Very good. Go on ahead and have a seat. Next, I'm going to check for your sensation. So what I want you to do is I want you to close your eyes. And I want you to tell me what sense you feel, what you feel. Sharp, dull, or soft?
Sharp.
Good.
Sharp. Soft. Dull.
Good.
Sharp.
Very good. Okay, so the next thing I'm going to have you do is I'm going to have you stand up. And I would like you to take a couple of steps heel to toe for me. Very good. Can you walk on your tippy toes for me? And how about walking on your heels? Perfect. Just go on ahead and have a seat. All right, so then the final test I'm going to do for you is checking your cerebellum. So I want you to stretch your hands out and touch your nose. Just keep going. Any faster you can go. Perfect. Any pain?
No.
Excellent. Do you have any questions?
No, ma'am.
All right. So I think we're done here. Thank you for your assistance.
Here, thank you.
And have a good day.
You too.
All right. So